Hello everyone, and welcome to WUTNews. Today's video is a comprehensive medical and public health documentary focusing on a group of infections commonly referred to as Atipis Mycoplasma, also known in medical terms as atypical mycoplasma infections. These infections are caused by unique bacteria belonging to the Mycoplasma family and are increasingly recognized as silent but significant contributors to both respiratory and urogenital diseases worldwide. Before we begin, we kindly invite you to subscribe to the WUTNews YouTube channel. Your subscription helps us continue producing high-quality health awareness documentaries, science-based medical education, and global public health content. Please subscribe, like this video, and turn on notifications to stay informed and protected. What is Atipis mycoplasma? Atipis mycoplasma is a term commonly used to describe infections caused by atypical mycoplasma species, which differ from typical bacteria in both structure and behavior. Unlike most bacteria, mycoplasma organisms lack a cell wall, making them resistant to many commonly used antibiotics, such as penicillin. The most clinically relevant atypical mycoplasma species include Mycoplasma pneumoniae, Mycoplasma genitalium, Mycoplasma hominis, ureaplasma species. These organisms can infect the respiratory tract, urogenital tract, and reproductive system, often causing symptoms that are mild, vague, or entirely absent. Because of this, Atipis mycoplasma infections are frequently misdiagnosed or overlooked. Historical background of atypical mycoplasma. The history of mycoplasma infections dates back to the late 19th century when scientists first identified unusually small bacteria that could pass through filters designed to trap other microorganisms. In 1898, mycoplasma organisms were initially discovered in animals. However, it was not until the 1930s and 1940s that Mycoplasma pneumoniae was identified as a cause of atypical pneumonia in humans. This led to the term atypical pneumonia, which is still used today. Later, during the 1970s and 1980s, researchers discovered that other mycoplasma species could infect the human reproductive and urogenital tracts, leading to conditions such as urethritis, cervicitis, pelvic inflammatory disease, infertility, and pregnancy complications. With the advancement of molecular diagnostic techniques, especially PCR testing, the medical community now recognizes atypical mycoplasma as a major but underdiagnosed public health issue. Unique characteristics of Atipis mycoplasma. Atipis mycoplasma bacteria possess several features that make them particularly challenging. They lack a rigid cell wall. They can live inside human cells. They grow very slowly. They evade the immune system effectively, and they easily develop antibiotic resistance. These characteristics allow infections to become chronic, recurrent, or asymptomatic, increasing the risk of long-term complications. How Atipis mycoplasma infects the body. Atipis mycoplasma organisms attach to human cells using specialized surface proteins. Once attached, they can damage host tissues by triggering inflammation, producing toxic metabolic byproducts, and disrupting immune responses. In respiratory infections, this may cause persistent coughing or pneumonia. In urogenital infections, it can lead to urethritis, cervicitis, pelvic pain, and reproductive complications. Modes of transmission. The transmission of Atipis mycoplasma depends on the species involved. Respiratory transmission, spread through coughing and sneezing, close contact in crowded environments, schools, military camps, and households. Sexual transmission, unprotected vaginal, anal, or oral sex, multiple sexual partners, asymptomatic carriers. Sexual transmission plays a significant role in urogenital mycoplasma infections, making them a form of sexually transmitted infection, STI. Symptoms of Atipis mycoplasma infections. Symptoms vary widely and may differ by infection site. Respiratory symptoms: persistent dry cough, sore throat, fever and fatigue, chest comfort. Urogenital symptoms in men: burning during urination, penile discharge, testicular discomfort, urethral irritation. Urogenital symptoms in women: vaginal discharge, pelvic pain, pain during intercourse, menstrual irregularities. Many individuals experience no symptoms at all, allowing the infection to spread silently. Complications of untreated Atipis mycoplasma. If left untreated, these infections can cause serious health problems. Respiratory complications: chronic bronchitis, asthma exacerbation, severe pneumonia. Reproductive and urogenital complications: non-gonococcal urethritis, pelvic inflammatory disease, infertility, ectopic pregnancy, pregnancy complications, and neonatal infections. Diagnosis and medical testing. Diagnosing atypical mycoplasma infections is challenging. Common methods include PCR tests, specialized blood tests, urine samples, urethral or cervical swabs. Standard bacterial cultures are often ineffective due to the organism's slow growth. Treatment options. Treatment requires specific antibiotics, as many standard drugs are ineffective. Common treatments include macrolides, example azithromycin, tetracyclines, example doxycycline, fluoroquinolones for resistant cases. Antibiotic resistance is a growing global concern, emphasizing the importance of proper diagnosis and complete treatment. Prevention and risk reduction. Preventing Atipis mycoplasma infections involves practicing safe sex, using condoms consistently, limiting sexual partners, regular STI screening, avoiding self-medication, seeking medical care early. Public awareness and education are essential for prevention. Global distribution and affected countries. Atipis mycoplasma infections occur worldwide. High prevalence is reported in Asia, Africa, Europe, North America, South America. Urban areas, densely populated regions, and countries with limited healthcare access experience higher rates of infection. Public health importance. Atipis mycoplasma infections represent a growing challenge for global healthcare systems due to antibiotic resistance, high rates of asymptomatic infection, impact on fertility and pregnancy, increased STI transmission risk. Improved surveillance, education, and diagnostic access are urgently needed. Living with Atipis mycoplasma. Individuals diagnosed with these infections should complete prescribed antibiotic courses, avoid sexual contact until treatment is complete, inform sexual partners, attend follow-up testing. Responsible health behavior protects both individuals and communities. Final message and call to action. Atipis mycoplasma infections may be silent, but their consequences can be severe. Knowledge, prevention, and early treatment are the most powerful tools. If you found this documentary informative, please subscribe to the WUTNews YouTube channel. Your subscription allows us to continue delivering trusted medical documentaries, sexual health education, and global public health awareness. Please subscribe, like this video, and turn on notifications to stay informed and protected. Thank you for watching.